I'll have to some explaining to do the wife. She just spent about $3,000 on new furniture. So sorry, honey.
Oh,
Gotta take that.
it's a
back.
good thing that stuff can't be moved. Thinking of the positive.
What time?
Oh, yeah.
I'll start with that.
Well, you could use the sink right there.
I will.
It's just not always cold right away. Okay, I know I've got notes on these
It's good
house
large
bills.
type, I can see that from here.
This is all very concerning. There's people with guns and badges.
We don't need no thinking badges.
No, they're here to get us. Okay, I have my notes. Now the question is, can I read my handwriting?
Oh, you take good notes.
I don't know about that. So in an effort to become more hip, I got one of these.
It's like a long
and
agenda
it's
tonight,
my
you think, or
phone.
not?
Well,
Is it not?
No, Dean sits there. Nobody ever sits there.
So I can just,
It just holds my.
It's a closed session.
I made my grocery list on here and I just,
wow.
yeah, it's pretty nice.
Can you read it though? 'Cause
No, I'm
thinking-
showing them. Now I don't have to do this, and then I hit a button and it translates it to text.
You know what I had one time?
But I don't know how to
Probably still have
answer
it.
a call
I
still.
have when I was working on my degree, I bought this, it's called a Live Scribe pen.
Yes.
You make
Yes.
notes and then it downloads it right to your
Yes.
computer. It's awesome.
Yes.
And you can record with
I
it.
think my
Does it
son.
download it in print or download in your handwriting?
It downloads it in a PDF file, in your handwriting. It's basically a picture.
I've got a call.
That's cool.
Easier now.
See what's going on, so, so he doesn't.
Yeah.
You can send that out.
Yeah, you draw like a
He has
box
to rush
around it
back
and hit
and,
copy and
I'm sure my
you can
phone's on
email
stun.
it.
Very
Like kids on vacation, he works hard.
It is
Ready for
for me.
My daughter went up there.
Somebody that
I'm just kidding.
still doesn't even have a DVD player because they
That is weird.
my children
That is
do.
way
I
weird.
just don't like any technology of any kind.
That is weird.
I'm not quite Tom Bensley, but I'm dangerously close.
session out of Kingston.
Those ages where things happen.
My friend from high school called me
I wanted to go.
to meet me. He's like, his Facebook post was something like, "We stood firm against
Because if they ask
growth or
questions, they're
something."
gonna ask you.
And I was like, what is going on? He's like, so I'm meeting him
So I
for
just said
coffee
keep
next
this.
week and he's gonna tell me.
Try.
Just an initial
I just said
brainstorm,
keep
but
this.
one of Brenda that owns the gym, she said, "We need a
Good evening, everyone. If we can get started with the Grand Traverse County Public Health and Safety Committee agenda, if we could stand for the pledge, please. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. The first opportunity for roll call, please, Sarah.
Johnson.
Here.
Crawford.
Here.
Propa.
Here,
Yep, we can tell. It's your opportunity.
I should have waited for the second opportunity for roll
Lathrop?
call.
I'm here.
Clearly.
Okay. Wheelock.
Yes, ma'am.
And I show Klaus and Max Bowers excused.
All right. The approval of the minutes of the September 2nd regular session. Do we have any questions? They'll stand approved as mailed. First opportunity for public comment. Sarah, if you would read the rules, please.
Any person shall be permitted to address a meeting of the Board of Commissioners, which is required to be open to the public under the provision of the Michigan Open Meetings Act. Public comment shall be carried out in accordance with the following board rules and procedures. Any person wishing to address the board shall state his or her name and address. No person shall be allowed to speak more than once on the same matter, excluding time needed to answer commissioners' questions, if any. The chairperson shall control the amount of time each person shall be allowed to speak, which shall not exceed 3 minutes. The chairperson may at his or her discretion extend the amount of time any person is allowed to speak. Public comment will be solicited during the 2 public comment periods noted in Rule 5.4 Orders of Business. However, public comment will generally be received at any time during the meeting regarding a specific topic currently under discussion by the board. Members of the public wishing to comment should raise their hand or pass a note to the clerk in order to be recognized and shall not address the board until called upon by the chairperson.
Having heard the rules for public comment, is there anyone wishing to make comment at this time? Seeing none, we will move forward. There will be additional opportunities for public comment later in the meeting. The next item will be the approval of the agenda. I've been asked to move the discussion of House Bills 4138 and 4947 through 4966 under special orders of business to allow Prosecutor Cooney the opportunity to describe the resolutions that are in front of us. He's here tonight to do that, and then he's got to move on to something else, more important probably. And secondly, I will note that the closed session in regard to Whitney versus Grand Traverse County will be held at the end of the meeting. We would definitely will have a closed session. Is there any other changes or additions to the agenda? Seeing none, I'll entertain a motion to approve.
So moved.
Second?
Motion by Johnson, supported by Crawford. All those in favor say aye.
Aye.
Opposed? Carried. This brings us to the consent calendar, if you would, please. Sarah.
The purpose of the
Yeah, I
consent
knew
calendar
you
is to expedite business by grouping non-controversial items together to be dealt with by one commission motion without discussion. Any member of the commission, staff, or the public may ask that any item on the consent calendar be removed and placed elsewhere on the agenda for full discussion. Such requests will be automatically respected. If any item is not removed from the consent calendar, the action noted, receive and file, or approval, is approved by a single committee action adopting the consent calendar. All information identified on the consent calendar can be viewed in its entirety at www.grandtraverse.org. A, receive and file. 1, Community Collaborative Update, October 28, 2015. B, approval, food service proposals, approved contract with Aramark Correctional Services Incorporated.
Having heard the consent calendar, is there anyone in the audience wishing to have any of these items removed? Commissioners or staff? Entertain a motion to approve the consent calendar as provided.
So moved?
Support. Motion by Kropis, supported by Johnson. All those in favor, all those in favor say aye.
Aye.
We don't have to roll call vote anymore. Okay, that moves us down to special orders of business. Mr. Cooney, please. As you may recall, Commissioner Kropa brought this to our attention last week, and Commissioner Cooney, or Prosecutor Cooney, was given the opportunity to draw resolutions for us in support or opposing these issues.
Yes, Bob Cooney, Grand Traverse County Prosecuting Attorney, and I did prepare the resolutions as requested by the board at last week's meeting, and I'll address the resolution opposing House Bill 4138 first of all, which is the presumptive parole bill. Essentially what the legislation does is it requires that the Department of Corrections release prisoners at their earliest possible, at their minimum sentence date. So if someone were sentenced to, say, 5 to 10 years, they would be released automatically at 5 years, unless the Department of Corrections is able to show by substantial and compelling reasons that the person is likely to be a menace to society. It's a fairly high standard. I know that the Prosecuting Attorneys Association and the Michigan Sheriff's Association have opposed this bill for the public safety concerns raised by this, rather than having persons educated in prisoners and correction systems. Essentially the parole board's making these decisions. We're leaving it up to basically fate, whether or not these prisoners are going to succeed or not. The Michigan Associations of Counties has opposed this bill because it shifts the burden from the state onto counties by releasing prisoners at their earliest possible parole date. It brings those prisoners back into our community. We know that about half of those are going to be returned for further criminal acts, and we know that some of this is going to fall on our court system, our prosecutor's office, the sheriff's office, other law enforcement agencies, and that's why MAC specifically opposes this bill. One of the problems with it is that in order for prisoners to be successful and not recidivate, You need to have good programming in place. We've got a few good programs, but they're already underfunded, such as the Michigan Prisoner Reentry Initiative, which is meant to try to get these parolees jobs and housing and family support or some sort of support so that they can be successful on parole. And as a member of the steering committee of MPRI, I can tell you it is vastly underfunded. It needs a whole lot more money for the parolees coming back into our community. So for two reasons, I support this resolution myself for public safety reasons and because I think it will end up costing counties more money. So if you have any questions about that one, be happy to answer
Anyone have
those.
any questions, comments?
I can comment a little just from the MAC point of view. They are trying to calculate the dollars that could be associated with this for counties if this bill were to pass. The initial estimates are anywhere from $500,000 to $1.5 million a year based on these two sets of bills, not specifically presumptive parole, but the juvenile bills as well. And the number one issue is the state of Michigan is going through with this prison reform and their intents to close 2 prisons, but the dollars that are saved aren't going into programming for the communities that are then left to deal with these people that maybe not necessarily should be out. And the recent MDOC charts show about an 18% number for recidivism, and most people are saying no, they're crying foul on that. And one of the reasons is the definition of recidivism is to be incarcerated for the same or worse crime within 3 years. And that doesn't always fit with who people are and what they do and when they return to the community. So there's a lot of discussion about the definition of recidivism, and MDOC is using this 18% number as a justification for this prison reform set, but there doesn't seem to be a lot of water to that. MAC is putting together the numbers now. I'll be down in Lansing in 2 weeks, I think, again. And then I met with Bob because we kind of worked on this together, and when the committee meets in December, I'm going to keep a good eye on what representatives are on the committee. But I will go down and try to insert myself in to speak for Grand Traverse County, or hopefully, Todd or Bob or somebody wants to be involved there, because they're not hearing from smaller communities where $500,000 to $1.5 million unfunded mandate is really serious. But then there's a whole other side of this that isn't finances. It's the public safety aspect of it. Who are these people that are coming back into our community, and what are they bringing with them? And we already know that we have issues with that. And so I would say that was one of the main things. The presumptive parole bill doesn't include a funding mechanism to earmark those same dollars saved from closing the prisons to the reentry and some sort of rehab programs for the prisoners. So it's not a good bill. It's just not a good bill.
Comments, questions? Captain Ritter, you have anything you want to add, or?
No, I'd be happy to have done that with you, or
You want to come to Lansing with me? Okay.
let me know what you'd like me to do.
You haven't ridden with her yet, have you?
He's going to put me in one of the cop cars where they can shut the window and stick me in the back.
Get a picture,
We're
please.
expecting first or second week of December for that committee to meet. We're tracking the bill right now. When I'm down in a few weeks, I'll have a better idea of that.
And I would just add that the House did pass this bill. The Senate sent it back to committee last month, and so it's tied up in committee right now, but now is probably the time to contact your senator.
So Bob did make a resolution for us. One of the things Max said that we could do as a county is pass a resolution, but what they said we really needed to do was contact our senators and representatives and discuss this as much as we could. I'm hoping that we can share this resolution with other county boards in our area, just as we receive resolutions as well. And if we're able to make that happen, I will try to attend those county board meetings so I can speak and discuss that on behalf of them. There are no counties in our 10-county area here that serve on the same committee that I do, so I'm pretty much the only voice of Northern Michigan on there in Lansing. So I'm not certain how many know about this. And then Bob is reaching out to prosecutors as well, passing on this information and trying to get them to talk to their boards.
I would entertain a motion to pass the resolution, and Sarah and Bonnie will assign a number to that resolution, opposing House Bill 4138.
I'll do it. I make that motion.
Motion by Lathrop, supported by
Crawford.
Crawford. Any further discussion?
Do we need immediate approval on this to get it
Yeah, we will,
going
because
faster?
we're going to do a roll call vote because it's a resolution anyway, and it will be for immediate approval.
And you'll notice Bob put everybody's name on this to have individual signatures, which is
Right.
different than our other resolutions that we do.
And
Yeah,
I noticed
we-
Commissioner Max Bauer is not here, so I need to remove her name. So-
Yeah, well, I'm sure she'll be back. I don't remember when she comes back. Next week?
No, she'll be here tomorrow. She's
Tomorrow,
just
so-
ill. Commissioner Klaus
okay.
is out of state until next week, however.
Okay, so we'll get signatures on this before they're forwarded, and we'll change them to all proper names too. Roll call vote, please, Sarah.
Crawford,
Yes.
Croupa,
Yes.
Lathrop,
Yes.
Johnson,
Yes.
Wheelock.
Yes, ma'am. Okay, the second item is a resolution in regard to House Bill 4947 through 4963 in regard to raising the judicial rate age to 18. Bob, would you like to speak of that too, please?
Yes, again, at the request of the board, I drafted this resolution, and as I indicated last week, I think a lot of my law enforcement colleagues support the general concept of this legislation, which is to change the age from 17 to 18 for those persons we treat as juvenile offenders. The problem is the legislation itself, and I can tell you that the Michigan Probate Judges Association opposes this bill as well, and that's noted in the resolution. And a lot of what's in our resolution is borrowed from the Probate Judges Association position paper, which talks about the fact that, again, this is an unfunded liability for counties. It shifts the burden of the programming for these offenders from generally the state onto county governments. And so for those reasons, I support this resolution as well. The problem is if juveniles are not provided with appropriate programming, and that might include both out-of-house and in-house detentions, they're not going to succeed. We're not doing the juveniles any favors by putting them into a system that we haven't even set up the programming to handle them. And this legislation does nothing to give counties the resources to work with these types of offenders.
Let us remember that when we have juveniles that are sentenced or are put in residential type programming, it costs Grand Traverse County hundreds of dollars every day those individuals are there. When we raise the age from 16 to 17 to those kids that are eligible for that program, or individuals that are eligible for that program, I suspect we're going to see a sizable number of people be involved in programming. You know, it would be interesting sometime or another to take a look and see how many 17-year-olds we sentence to adult prisons in Grand Traverse County a year.
Well, I would guess it's going to be 20 to 25%, because if you look at the ages where we start bringing juvenile delinquency petitions, you know, you're talking about generally 12 years of age, so we're talking 12, 13, 14, 15, 16, and now 17. And of course, we see the older you get in the age categories, the more offenders you have in those age categories. And so the other thing is, I was looking at the Senate fiscal report from 2012, which shows that the cost of a juvenile delinquency home for one day is about $487 compared to $87 for an adult offender. Now, typically, adult offenders are being housed for a longer period of time, but that is a huge expense when I talk about programming and services for these juveniles. This is not inexpensive stuff. This is mental health services. There are also health expenses involved in that as well. that may not be covered by Medicare or some other government source.
Dan?
Yeah, both of these bills, this one included, you look at it, and what bothers me is that the state isn't looking to improve things, they're looking to shift costs. And this is obvious in these bills, so I think we need...
That's not a unique experience.
Yeah, I guess not. You know, it bothers me because these people need help, and to shift it to the counties, we don't have the money either, so it just wouldn't get done right. I think we need to support this resolution.
I think the comment that I would make is, to me, it's not strictly about the cost, although the cost, we need to make sure that the county remains whole in some fashion for that. But I think the justification for the bill is the fact that these 17-year-old kids need treatment, they don't need incarceration.
Yeah.
And I think that's the justification for why the bill is being discussed in the first place, is taking a 17-year-old kid and incarcerating him in a state prison where there's all kinds of individuals that are there for multitudes of reasons, is sometimes vocational education, which we just assume they didn't have, and have an opportunity to provide them with better programming. Makes a lot of sense. The problem is, if the state is going to pass this, they need to make sure that the counties remain financially whole in their providing this treatment that is required.
Which makes me think it's just for money on their behalf.
Could be.
There was a discussion about what you said, and they said the majority of the juveniles tend to be at the Thumb Correctional Institute, I think it is. They're kind of cognizant of trying to keep the ages together. I'm not sure that it really matters, though, because they're still picking up things that they aren't. And one of the prosecuting attorneys here on the panel and the judges discussed a lot how the majority of 17-year-olds don't go to prison. So when you have a 17-year-old that does go to prison, they probably need to be there. And we probably don't want them in our community, particularly with a lack of guidance and programming. We can do all we can do to fix our budget and get our structural deficit set, and a set of bills like this can be passed in Lansing, and overnight we inherit a couple $1 million cost. And they equated it a lot to the child care fund, which people love to talk about here, how one family can throw us out of whack. These bills are an almost sure thing for that. And so it's sad because we have to look at the numbers, but the bottom line is people aren't getting help that need to get help, and it endangers our community as well. I think it's just sort of a no-brainer. I'm not certain, the sponsors for both of these sets of bills are not from our area. They're downstate, and I'm not certain what special interest group is pushing it. I haven't had time to read. But what I will do is, once the resolutions are set, I'm going to contact our representatives and senators with copies of our resolutions, and they might not represent us, but they represent counties around us with similar budgets and that sort of thing, and maybe they can hear that Northern Michigan isn't real excited about this set of bills. But the 22 county commissioners that sit with me on that commission, none of them liked this bill set at all. So, but we can't live in a tunnel here. We can't balance our budget not thinking about external forces like the state, and it's important to constantly keep an eye on what's going on in Lansing and that sort of thing. So we're fortunate to have MAC to do that, and we're fortunate that our prosecutor is part of the Prosecuting Attorneys Association of Michigan, which also watches our back on this stuff. So I will make a motion to support resolution number such and such, opposing raising the jurisdictional age of juveniles to 18 years old.
Support. We have a motion by Kropis, supported by Johnson. Further discussion?
It's immediate approval, right?
Well,
It'll be roll call.
It'll be a roll call because it's a resolution. Roll call, please, sir.
Kropa?
Yep.
Lathrop?
Yes.
Johnson?
Yes.
Crawford?
Yes.
Wheelock?
Yes, ma'am.
Chairman Wheelock, one other matter, and I thought this was going to be moved to special orders also. I'm here tonight with the Missaukee County Sheriff to discuss the transfer of fiduciary responsibilities for TNT, and I don't know whether you still wanted to move that up or not, but
I'm sorry, I didn't know that we were moving that
I
one
didn't know that
beforehand.
either. I just knew the bills. That was the only part I knew.
That
So
was the
that
only
was
thing I
probably
was
my
asked
fault.
to move, so
You can always take it out of order.
I'm going to ask Mr. Kovac if he would mind if we discuss that very briefly, because I don't think that discussion is going to take long, and I'm thinking his discussion is going to take longer. And if Mr. Kovac has no problem with that, we will go ahead and move on to that if everyone else is okay with that.
It's fine.
All right, so then I'm going to make a decision right here. We're going to move the fiduciary responsibilities of the Traverse Narcotics team to the first item under department action items.
And I do appreciate
We can do that right now.
Thank you. Sheriff Bosher. I have with me tonight Sheriff Jim Bosher from the Missaukee County Sheriff's Office. And Sheriff Bosher is the president of the executive board for the narcotics team. I'm the treasurer for the narcotics team executive board myself. And what we're asking for is that we transfer the responsibility for bookkeeping and grant writing and acceptance of grant monies and those types of administrative functions to Grand Traverse County. Missaukee County has been the fiduciary for the narcotics team for the past 23 years. And I think Jim has been the chairperson almost as long. And so if you have specific details about some of the items that I mentioned in the memorandum I provided to the board that's in your packet, Jim is probably the guy that is going to be able to best answer that, just because he's been around so long. I did discuss this at length with Dean Bott. He felt that this was certainly something that the finance department could take on. We are the largest by far of the counties on the narcotics team, of the 9 counties plus the city and village of Elk Rapids. And there is a small stipend for covering those expenses of accounting, and the idea is here is that this is not going to cost the county any money, although it's going to take up employee time that we're probably not compensated quite enough for. I'm sure Jim probably didn't feel that Missaukee got compensated entirely for the time that the staff in Missaukee County spent on this. There are a couple of items that I think possibly do add some expense, although I think it's fairly negligible. And one of those is, I mentioned in the memo, that Missaukee County has maintained through its insurance carrier, its blanket coverage, coverage on 2 to 4 undercover narcotics vehicles plus a raid van. And those, I'm not quite sure how that got started, that Missaukee County just put those under its insurance policy. Maybe there should have been some compensation from the other entities involved in the narcotics team, but that has not happened for 23 years. And one of the government entities has to take on that responsibility, and so that would be one of the things that would possibly be an expense to the county. And I don't have a figure for you, but we do pay a per vehicle rate for insurance coverage for all of our vehicles. I think Jim can tell you that in is it 20 years as chairperson?
Almost 22.
Almost 22. There has never been a claim because of something that involved a narcotics undercover vehicle covered under their policy. The other thing that you might be interested in is there are 2 employees that work for the narcotics team, and they're currently Missaukee County employees. There's a receptionist, secretary person, Sue, who handles all of the administrative work over there. And there's a retired state police officer, Al Brown, who handles our forfeiture cases for us, does most of the background work there. They're both part-time employees. They do receive health benefits through Missaukee County, but it's a pass-through. We receive grant money and other funding, and that money goes to Missaukee County and gets paid out to those employees. And so it shouldn't cost the county any more money unless we had a better health insurance program than Missaukee County does, and we don't, from what I understand. And so for that reason, I think that there's no expense here. If it did work out that there were some additional expenses, I think that we could work with the other entities involved in the team and figure out, what the cost of that is. Typically with narcotics teams, because they're multi-jurisdictional, the responsibility for fiduciary passes to each entity, every 3 or 4 or 5 years. And it's certainly Grand Traverse County's turn. I think we, according to Jim, we were the fiduciary over 20-some years ago, over 23 years ago. Leelanau had it for a short time. Benzie had it for a short time. And, there are some entities that haven't taken on that responsibility. But I think because we're the largest entity involved in this narcotics team, it would make sense to do this. The reason Missaukee County is looking for someone else to do it at this time is because Carolyn Flores, their clerk, has retired. She handled, in addition to her responsibilities as clerk and part-time administrator for the county, she also handled the TNT books, and she, again, she's retired. They have an administrator who has no interest in handling this themselves. Missaukee is a fairly small county, I think, 16,000, 17,000 population, and so they're asking for someone else to take it on at this time.
Comments, questions? Dean, do you wish to speak to this at all, or?
No, Bob and I have talked. I've actually talked to Carolyn quite a few times. We account for and administer numerous grants, and I do feel that the 3,000 is actually administrative, grant administrative dollars that are allowed, and I feel we can take on the accounting without too much additional effort. The one thing with the employees, I don't believe they have any legacy costs or retirement costs, which I know that the board would be concerned about that, and there are no such costs with either of these two individuals.
Dan?
I noticed vehicles on here, insurance for vehicles and stuff. What about, who buys the vehicles? These wear out stuff. Who buys these vehicles?
Those typically are seized vehicles. They're the ones that they used in the undercover operations. Every 4 to 6 months, they cycle them through, and we just have to keep insurance. It's not like they're driven every day. It's when they're used in an undercover buy, and then they're parked, hidden away in a garage.
Wow.
There would be no cost at all that would be passed on to your county like Missaukee. We just put them on our insurance, and the quotes that I've heard that it costs, it's between like $50 and $75 per vehicle, depends, and we're with Municipal Risk, which I believe is the same as what Grand Traverse is with. So they just added on to your fleet plan. So any expenses TNT will pay, employees and everything, you're just holding the money, and they're pass-through monies because TNT is a non-entity.
Thank you.
Lisa?
I'm going to make a motion to transfer the fiduciary responsibilities for Traverse Narcotics Team to Grand Traverse County from Missaukee County.
Motion by Kropos, supported by Lathrop. Further discussion? I think Grand Traverse County has been fortunate over the last little while, particularly to receive a lot of benefit from the Traverse Narcotics Team. We've had a long history. We had a little rough patch for a few years, but we've kind of come around past that, I think, and we all recognize that we have a significant drug problem in our community that we really need their help to help us control. So, roll call vote, because you want this for immediate approval, Bob, or you don't care?
It doesn't matter if you want to wait till the end of the month.
Okay. Dean, do you have a preference?
I think we can wait until the end of the
Okay,
month.
then we'll just, all those in favor say aye.
Aye.
Opposed, the same? Motion
We're
carried.
actually looking to transfer the function at the first of the year.
Oh, okay, so we're good. We'll just pass it at the end of the month. Thank you.
Thank you, Bob.
Okay, this brings us back to Northern Lakes Community Mental Health presentation. Mr. Kovac.
Thank you and good evening. I appreciate the opportunity to be on your agenda this evening. And the purpose of this presentation is to repeat what Northern Lakes has historically done in terms of coming before each of the county commissions that form Northern Lakes Community Mental Health and give you an update on our performance and our finances and so forth. And so I appreciate the opportunity to do that. Certainly, you know, Commissioner Crawford is on our Northern Lakes Board of Directors, and Gerald McKetty is also a board member, so I'm glad he's here because the one portion of this presentation that I would like to take you to is the survey. And I don't think I have that on an overhead, but that's okay. The survey is on page 26 of your packet. And the reason for the survey is that the board of Northern Lakes Community Mental Health and certainly the management really would appreciate your feedback in filling out this questionnaire that's on page 26 of your packet. And it really speaks to our wanting to be very much linked with those communities that we serve. And Gerald headed up the committee to put this questionnaire together. So I ask you if you'd please take the time to let us know what you think and give us your feedback. The first page in your packet on page 20 is a list of all the services that are provided, and that is related to question 1 on the survey. So that's a reference document for that. So please, anything that you can do to let us know how we're doing, we would appreciate, and we'll collect that information from you and compile it, and then the Board of Northern Lakes will really review it and see where we need to improve, where we need to do better. So, any questions or thoughts about the survey? I think you've seen it before, and it may be a different form.
And all of us have a hard copy on our desk, which we will get filled out and get it to Chris so she can forward it to you.
That would be great.
I'm pretty sure that I might have talked about mental health services in the community at least once before. You know, and we all understand, you know, Grand Traverse County pays a significant amount of money to Great Lakes Community Mental Health, or whatever we're calling Northern Lakes.
Northern Lakes.
We've changed the name a couple times along the way, but, you know, and overall, I think they do a great service for our community. There's definitely some issues. You know, I always get into a discussion about what our per capita rate is of people that suffer mental illness in our community. And, you know, I've heard all kinds of comments about the fact, well, you know, the state hospital was here and the state closed that and basically turned people out onto the street. But we're multiple generations past that point, and we still have an extremely high per capita rate of people having mental issues in our community, which, you know, seems kind of strange to me. You know, but, you know, that's a whole another part of the discussion. You know, the piece that I've been a little vocal about a couple times is the fact that I believe that the enabling documents that created the regional mental health organization was responsible to provide services in our jail. You know, it's very specific in the thing. You know, we've got an Attorney General's opinion from Mike Cox that says, no, that's the county's responsibility. But, you know, we're still on the hook. We're still spending a lot of money trying to provide mental health services in our jail. We've been fortunate over the last few years to be able to contract with Dr. Conlon. Yeah, I was going to say, I was going to say Collins, and I knew that wasn't right. That's on the other side of the room. But Dr. Conlon has been able to provide services, although we have been notified that she will be leaving near the end of this year. So as we move forward with contracting for medical services in the 2016 year, we need to address whether we're meeting the mental health needs in our jail and what the additional cost for that is going to be. So, I'm also aware that the fact that the $687,000 or whatever it is that we pay annually, that dollar amount hasn't went up for the last 10 years or so either. So there's a wash here, but the overall thing is, my comment is, as a community, we're fortunate to have Northern Lakes Community Mental Health here. If there is a shortfall in my mind, it's whether or not we're meeting the needs in our jail. Other comments? Questions?
All that sounds very familiar.
You may have heard me say it at least once or twice before over the last
Yes, and I appreciate that. What I'd like to do is just sort of walk you through the packet of information. There's a lot of information there, and you can almost get lost in it sometimes. But I just want to kind of go through it, walk through it, and you can ask questions as we go. But we wanted to put a packet together that first showed you what our revenues are and where they come from. And I'll remind you, this is for fiscal year 14. So October 1 of 13 to 9/30 of 14. And you can see how our revenues are distributed. Medicaid is almost 70% of our revenue. Local revenue is about 2.7%. Our My Choice Waiver Program, which is the alternative to nursing home treatment, has been on a very sharp slope of growth, and in that fiscal year, it was $7.8 million of our funding. And then we have on this slide the expenditures, so you get an idea of where we spend our money. And the inpatient services, starting at the top left, residential contracts cover the people that we have to provide residential treatment for. That's heavily weighted towards individuals who have an intellectual or developmental disability. I mean, that's about $15 million of our budget. It's a huge section of our budget. And then we contract with agencies to provide services that we don't directly provide. Personnel is just about 30%. And you can look at the direct operations and contractual services and so forth. So that's just an overview of our revenue and our expenditures in that particular fiscal year. The next page in your packet actually provides you all those definitions, so you don't have to guess about what's in what category. We wanted you to have that information. The next piece of information, let's see if it's this slide. Yes. Now this, we wanted to display to you the services delivered over all 6 of our counties, so that you could kind of get an idea and compare. Because I know there's issues about, which county delivers how much in local revenue and so forth. But this gives you a broad look at the services that we provide. We've categorized them in 7 different categories, starting with assessments, case management, crisis, inpatient screening, inpatient, psychiatric and outpatient, and so forth. Residential living supports, you'll see is that from that pie chart that shows up here on the table. So if you just 2 columns in or 3 columns in is Grand Traverse County, and so you'll see that at the bottom line, total claimed services is about $23.4 million. So the services that we provide in Grand Traverse County, that's what the value is for those services. We have to add some overhead, so you keep going down, it's $24.9 million in services and overhead. And the next section tells you, it talks about the grand total cost, and then it talks about the number of registered people receiving services. And that's, I think, another important number. It's 2,681 people are being served in Grand Traverse County. The average cost per person is a little over $9,000. So the costs are expensive in treating the population that we serve of people with severe mental illness and people who have intellectual and developmental disabilities. And as you go down that table, it breaks it out in terms of the service populations, people with developmental disabilities, 457. Adults with mental illness, 1,656, and children with mental illness, 568. The thing that I always find interesting in looking at how we provide services is you'll see below, that those 457 people who have a developmental disability, we spend $13.5 million for those individuals. Really more than half are for the population that we don't even have in our organization's name. We don't say we're the Northern Lakes Community Mental Health and Developmental Disabilities Organization. So it sometimes surprises people that so much of our budget is spent on individuals with intellectual and developmental disabilities. So we have that. If you keep going down, we just summarized it for Grand Traverse County. Another way to display the information, but just focused on Grand Traverse County. And we put the amount of money that we spent by service and what percentage of the total that particular service line is. And you'll see there with residential and living supports that it's 57.4% of the budget. So providing safe residential environments for people who are very vulnerable is a very big part of what we do. And we put that in a pie chart so that you could see it that way for Grand Traverse County. And we also included that information for all counties summarized, so you can see how the dollars fall out by service and the percentage. And so that allows us to compare county by county what we're seeing and what's happening. And a pie chart for that. So that's a lot of information, I realize, and so forth, but I'd be happy to try to answer any questions that you have.
I have a question.
Yeah.
What is it, Sonny, that we spend a year on this service, our county?
$687,000.
$680,000, but we get $23 million worth of service a year. Is that right?
That's correct.
That sounds like a good deal to me. Yeah.
I think it is. I think those county commissioners who decided to take advantage of the program that the state was offering for community mental health services was very showed great foresight in terms of what the return would be to the counties by doing that.
Well, we can have all kinds of discussions about the numbers, and the numbers are what they are, but the fact is you're serving 457 people with disabilities to the tune of over $300,000 apiece per year. That's pretty damn expensive service. You've got a total
That's not 300,000, it's 30,000. People with developmental disabilities?
Unless I did the maybe I did the math wrong here.
It's 30,000 per person for Grand Traverse County.
To get to 13.5 million or 13.6 million?
If you look on the bottom of the chart, it says on average cost per person, average cost for a person with intellectual developmental disabilities is $30,000 per person.
Per year.
Per year.
Yeah, it's not, maybe I did the math wrong, but I don't know.
Then that's 457 people.
457 people times 30.
Right. Yes, and I can tell you, you know, about the people that we serve there. These would be people who would be in an institution like we have here, or the institution that we had for what we call the mentally retarded, that people would be, you know, warehoused and so forth. The whole movement has allowed people to come out of those situations and live in the community, but the trade-off for that is that they need a lot of support services. And we're very mindful of the cost of those, and we're very mindful of being good stewards of the dollars that we're given. So we look to do that as frugally as we can, but at the same time, if somebody requires line of sight monitoring 24 hours a day, you have to have staff to do that. And so that's part of why those costs are so high. I mean, we have people that, you know, have to have one-on-one supervision because they're combative, they're out of control, you never know what they're going to do. I mean, the people who are served there are, you know, they would have been locked up before. And now they're given the opportunity to be in the community and to live a quality of life that's so much better than they've experienced. But the outside of that is that it costs. And so, yeah, but I think, you know, if anything today, just us being able to talk about how expensive it is to provide those residential services for a relatively small population is just, it's eye-opening, I think. So I appreciate your comments too about the trade-off between the 600,000 and the 24 million. I think it's a good deal too.
I did do the math, and for services provided, Grand Traverse County receives 47% of the services. But my question is, total people served, this is on, I don't know what page, you're 24. You have 2,681 people served, and that's in Grand Traverse County. Oh, God, I have got to get it. Can we put a note into the IT department?
It'll be 2,682, so.
2,682 is me. I'm the additional one.
Got that.
But so I just want to make sure I'm reading this correctly. We have 2,681 people are served in Grand Traverse County this fiscal year 14, correct?
Correct.
Okay. And the total for 2,681 people's treatment was $24 million. So it's clear where the problem is. The problem isn't the dollars that Grand Traverse County has given, it's the problem is what it costs to treat people. I mean, clearly that's a lot of money. And we're talking about just 1 year's worth of costs for them. Am I correct on reading this that way?
Yep, it's just a one-year report.
So that, I'm trying to do my math with glancing with poor eyesight. So we got 24 million divided by,
It's $9,000 a person, approximately,
$9,308.
per person.
Did you do that in your head?
No, I used the calculator on the computer.
well, I got that number 3 times and I didn't think it was the right number, just
Oh, it
to
is.
let you know, because I was multiplying 2,600 in my head by the 9 and it wasn't coming out to it. So that, I guess that's, I mean, Sonny's frustrations are valid, but I don't know that it's necessarily the percentage of what we pay versus the other counties. I think it's just acknowledging and embracing the cost of mental health services in general. And then, of course, the idea that they're getting services rather than being housed in our jail, or they're getting help rather than committing crimes, which presents all kinds of issues in our community. And there probably isn't an answer to this, but I appreciate the statistics.
Carol?
Thank you.
As far as the contribution, we contribute 42% of that 1.6 million, and we get 46 to 47% of the services provided. So it's pretty close.
You know,
I know you don't
We've
like
had a lot of discussions for years,
I
and
know.
I'm sure that we're not going to change all of our opinions tonight. You know,
Nope.
one of the issues is always because the services are available here, are these Grand Traverse County people that are being served, or are they coming here to
How did,
to
there
deal
was,
with that? And that's always an issue about how we track that.
they used
too.
didn't use a formula to figure out exactly, is it where they live or where they, what did we decide on that? Where they live or where they receive the services?
No, well, I think we went in and looked at both and used zip codes to identify people. And so it's, our finance staff have done a lot of work to try to get the numbers as exact as we can. You know, there's always going to be some migration, but I don't believe it's significant in any way. And so this is data that I think, you know, we can look at, we can discuss, and we can develop policy by. I mean, if you look across that one row, for all 6 of the counties, the average cost per registered person is $8,904. So Grand Traverse is a little above the average. Leelanau is at $13,000. Misaki, $10,000. So, you know, there is some variance by county. And, you know, part of that, too, is, you know, where people are and where they're getting the services.
Dan?
This is a lot like our jails and our courts, and we spend a lot of money on just a few people, but what other choice do we have? We have to do this job. It's expensive, but that part of what makes our nation and our community great, that we do attend to these people. So
It is the safety net.
yeah.
For the most vulnerable people. There are people in our residential placements you could just not leave alone for any significant period of time. You can't let them outside. You never know what they're going to do. I mean, they're just functioning at a very low level, and they're very vulnerable. And I appreciate our staff who do the direct work with these individuals. You know, I'm in an office most of the time. They're on the front line, and they're doing a great job, in my opinion.
I thank God for those people. That's a tough job, and sometimes it's unsavory. You know, thank God for people that are willing to do that work.
Amen to that.
Well, and, you know, we've had multiple discussions over the years about the fact that we spend well over 70% of our budget, managing 3 to 5% of our population. It's just the way it is.
May I just add one other piece of information,
Absolutely.
just that you may find of interest? In terms of our staffing, of our direct employed staff in our Traverse City office, the payroll and benefits to those folks is about $8.6 million. So these are people who live and work in the community and provide services through Northern Lakes. So we're happy to be able to not only serve the community, but also to be an employer of people and contribute to the economy.
Further questions? Bob?
Yeah, I mean, that was one of the things I noticed first, actually, was that your personnel costs are really pretty low. You know, for most industries, it's a lot higher than that, but you know what, I like the charts and the numbers you've given us, and as we always look at what value are we providing, I mean, I'm convinced that we're providing a good value for the dollars for right now.
Thank you. I'm glad to hear that.
Further questions, comments? Thank you very much.
My pleasure. Thank you very much. And
Nice job, thank you.
Carl.
if you have any questions, please contact me.
We know where we're at. Central Dispatch Board of Directors bylaws. Jason?
Good evening, Jason Torrey with 911 Central Dispatch. Short agenda item tonight, the agreement, the agreement to participate that was dated back in 1995 was seen by the current 911 Board of Directors as proposed to be redrafted back in, I think it was January. The Emergency 911 Service Enabling Act allows for the board to make that appointment, or create that district, and delegate certain powers to that board. I gave you both the agreement to participate from 1995 and the revised bylaws that were signed by all the current members of the Board of Directors as proposed and adopted in April of 2015. We're looking for approval for those bylaws.
Comments, questions? Lisa?
I'll make the motion. I mean, I was part of the creation of these, and a lot of effort was put into them, and this is just sort of a housekeeping issue. And so I'll make the motion to approve the Central Dispatch Board of Directors bylaws of 2015.
Support.
Motion by Kropos, supported by Crawford. Further discussion? All those in favor say aye.
Aye.
Opposed, the same. Motion carried. Thank you, Jason. Cycle 6 Health Department accreditation. Wendy.
Wendy Truitt, Health Officer, Grand Traverse County Health Department. I'm just going to give you a kind of a quick overview and summary today of the accreditation process that local health departments go through. We just completed our 6th cycle. It occurs every 3 years, and you're evaluated for all, kind of all 3 years, but they mostly look at your most recent year. And it's a requirement in order to be eligible for a lot of the grant funding that we get from the State Health Department. Just in the way of background, the public health system really exists to keep people healthy and safe from disease or injury by providing vaccinations and disease prevention programs for all ages. We ensure that food, water, and air are safe and clean. We respond to emerging health threats like we've seen in our community with H1N1, the fungal meningitis and infections from the tainted drugs and Ebola. We identify and promote policies that create healthy communities. We serve as a key resource for reliable health information and protect communities against environmental hazards. And we work to ensure that access to healthcare services is available for all people. And ultimately, public health focuses on identifying health risks and prevention programs before an individual becomes sick. So the state process identifies and promotes the implementation of public health standards for local health departments. In Michigan, there's 45 local health departments that serve the 83 counties. And they're either a single city, as in Detroit, or a single county, like Grand Traverse, or a multi-county district health department. Each local health department is part of their local government, and it's separate from the state health department. We assure that, and the process ensures that local health departments maximize their potential to protect and improve people's health in the community. And really, it's a great program for routinely assessing your performance and improving the quality of your programs. And it's similar to the process that hospitals, schools, police, and fire departments go through for the services they deliver to the public. And it's a collaborative effort, as you can see, for many agencies from the state, 2 from the public health sector, and then Department of Ag, DEQ, and Health and Human Services. It evaluates the process, the local health department's ability to meet the requirements, and accredits departments based on their ability to meet the standards. So there's 3 steps. The first is a self-assessment step. This summer I brought before you the plan of organization for the health department. You approve that, and so that's the first step, and you send that in 2 months ahead of time, and it delineates the statutory powers and duties, how we operate locally. You summarize your strategic planning and the local community health needs assessment process that I've spoken about, and how we address some of those local priorities. And the second step is what happened for us in August, specifically the day after the big storm hit. So it's kind of crazy time. And this is an on-site review, and there's reviewers from all the different agencies that I talked about, and they do an examination of the required documents. So they're looking at our program-specific policies, protocols, and procedures. They have discussions with staff. And by discussions, I really mean in-depth interviews. They observe the staff in clinics. They observe them doing restaurant inspections, permits for septic, things like that. And then they verify that the local health department is meeting all the requirements. And it involves all staff at all levels. So it's not just myself and the management team. It's everybody you can imagine is involved in this kind of week-long intensive process. And then the third step is if there are findings or you don't meet the requirements, then you have to do corrective action plans. This is the 11 core services that they evaluate, and this kind of equates to our comprehensive grant from the State Health Department. So it looks at our kind of powers and duties, food service programs, communicable disease and control, that's like outbreaks, hearing and vision programs, immunizations, on-site wastewater treatment, which is septic program, HIV and STD, family planning, the WIC program, and children's special health care services. So how did we do? Well, we were evaluated on 147 different indicators, and we met all of them. This is the best that you can do. It's the first time we've accomplished this. We came close in cycle 5. That was right before I got here. They missed 1, so I guess the next step is to miss 0. So staff did a really great job. We don't need to do step 3. We have no corrective actions that we have to submit. And we also received numerous special recognitions, and that's what I'd like to kind of go through, some of the highlights tonight. I don't have a written report because I just got it and it's 80 pages long, but I thought I'd give you a little verbal summary tonight, and then once we actually get the official certification and certificate, I can come here with staff so you can congratulate all of them as well. So some of the special recognitions were our professional response to the pertussis and the measles outbreaks that occurred at the same time, and how the management team showed the value of the cross-training of the staff, how we effectively used media for communications and our incident command system, and the leadership in regard to internal direction and information dissemination. As a result of that, we really have an incentive to try and improve practices, and we do that. So after the outbreaks, we're really focused on what we could do in the community to improve the waiver rates. And we did a lot of proactive things, and we were instrumental in the creation of the Regional Immunization Task Force. They like the way that we monthly track. We have a scorecard. I showed it to you during orientation. So we track all of our programs and all these, and we're always looking for making sure we're on track in the programs and ways that we can assess our productivity. And then environmental health was commended for the maintenance of their records and the quality of their records and their timely response to foodborne illness investigations. We also utilize a lot of collaborative partnerships to leverage our resources and manpower, and that's how we're able to extend the scope and the effectiveness of our public health services. So some recent examples of that are our emergency preparedness kind of collaboration we're working on, and our medical examiner collaboration for 3 counties. One to note for the commissioners is they were very impressed with the high-quality facility and thought that this was due to cooperative and visionary work of the county commission and health department leadership. And they also liked our innovative spirit in linking evidence-based needs, and those come out of the community health needs assessments or other things that happen in the community, and then finding creative solutions to find funding. So we were able to find some funding centered around water safety in our community, so the water safety stations and then the beach monitoring for the E. coli. And we do a lot of presentations to the community and at various state conferences, and so we've done them on Ebola preparedness, managing our outbreaks, the fungal meningitis contamination outbreak, some community ones that focused on ethics and vaccinations, and then several on water safety. They like the collaborative efforts our vision and hearing program does with the Head Start program locally. They recognize the high quality of our emergency preparedness plan, and also that we place high value on empowering staff through cross-training and providing continuing education. Also, that our communicable disease staff are always assessing trends, and we report to our community partners quarterly so that they can kind of get ahead and be prepared. We have excellent immunization program in general, but our policies and our process for managing and tracking vaccine, as well as stocking the private vaccine, and so we build private insurance, and that's available for anybody, not just those that don't have insurance. And then finally, we were commended for our drive to identify and get in front of emerging issues. So being proactive is something that I value, and it's really an expectation organization-wide. And I think the comment was that there was a window into the workings of a top-notch local health department. So overall, I'd say that the reviewers just, every time I went into an exit interview, they just had wonderful things to say about all the staff, how well the review and the whole process went, and they really seemed to kind of capture the essence of what the management team and myself have worked really hard for in the last 3 years, and that's to be efficient, innovative, proactive, and empower all of our staff to be able to do their jobs to the best of their ability. And I really think that this accreditation process confirmed that what we do day in and day out is valuable, and that we have high-quality work and very dedicated staff. So I couldn't be prouder of the results. It really speaks to everybody who works there, and they work hard. So I'll be back in December, hopefully with a certificate. Any questions you have at all tonight on the process?
I have.
Tom?
Have you gone out on any of those evaluations yourself? I know that they usually take individuals from other departments which came in here. Have you gone out on any of those yourself?
You mean actually become a reviewer?
Right.
No, because if you're actively working at a health department, but there are quite a few retired public health administrators and others who are the ones who then become the reviewers, and they go through a process.
Do you build these great measurements? Do you build these into performance appraisals for staff? Do you link it?
Well, we don't. Countywide right now, we don't do performance appraisals, but we do in the fact that we are assessing and tracking for a quality improvement process and productivity. So if we see through our monthly monitoring or quarterly monitoring that someone is not quite keeping up, management will then talk with them and give them tips on how they can improve or see what the issues are.
It's impressive that you were initiating this in your department, because it really scrutinizes and measures, and a lot of people don't like that. So I'm familiar with those. The police do the CLIA program, and I've worked on a couple of those. But I commend you on that and leading it through. And we can talk sometime about how we can link it into performance appraisals and those kinds of issues. And you've got a good data bank. Mm-hmm. You need to find different ways to utilize it. But it's very impressive and good for you for getting that in and for the results. How many, is that unusual to have a perfect score?
I think it's fairly unusual. We had been hearing
You
that...
could have said yes, I would not know, otherwise I'd be more impressed if you wanted to.
I'm not aware of others who have gotten it, but I don't know all the results for all the counties.
So I've only been through them with police departments, and they were
Yeah.
never perfect. There was always a lot of things to work on, which is exactly why you do it. But
Yeah.
if it's a standard that's very high to meet and you've met it, congratulations to you and your people, so it's very
Thank you.
impressive.
I think we all recognize the quality of the department and the staff that we have at the Grand Traverse Health Department. They have a long history of providing exponential service to our community. Other comments, questions? Bob?
Well, I just, part of it that's really impresses me is the proactiveness and the forward thinking. I mean, it's one thing to just say we've got to provide these services and that's all we're going to do, but to continually to think how can we improve, that's what we need in this county, and I'm grateful you're there to help head that up and pass to your department. You know, as we say in the military, bravo Zulu. So
Thank you. I really think that's kind of that's who we are.
Yeah.
We
Well,
really do try to be proactive and innovative.
And the fact that Grand Traverse County continues to be a leader in the region, you know, our entire region benefits because of the proactive, cooperative ventures of Grand Traverse County. You know, I always have a hard time talking about, you know, the Benzie County line or the Lindenau County line as if they're a cement block wall, since how both of them are within about 3 miles of my house, you know, so, but it is what it is.
Well, I thank you for the comments and hope that you will, even if you have to repeat the same ones when all the staff are here, I hope to bring a lot of the staff to the next meeting when we have the certificate, so.
Thank you, Wendy.
Thanks.
Thank you, Wendy.
Thank you.
Okay, first item under unfinished business, a contract for a labor attorney. We have a draft in your packet. Tom, do you want to speak to this, please?
Well, we've, a number of the commissioners, I think, have had some exposure and work with Peter on a number of issues, and Paul Segal and I interviewed him in depth, and he does have an impressive resume, and we think that he will be of real value in moving ahead with the labor negotiations and the 5 union negotiations we have to start negotiating with right away. So we need an outside resource, and he's one of the best.
Dan?
I first met Mr. Cole. I brought him here, I think, 3 years ago to talk with you, this board. Actually, I think only you and I, it wasn't this board, it was the board. And many of the landmark decisions that have been made in county government, labor relations, he is the one that has brought these to the Supreme Court or to various other courts. So he's probably the most knowledgeable labor attorney. He's the one that does all the lectures for MAC, and there's just no doubt he is impeccably qualified to do this. I think that the price he's charging us is very reasonable. He has a home on Old Mission Peninsula and a business in Lansing, so when he comes here, and we do need to have someone outside of the Grand Traverse County be a labor attorney, so they have no connections here. But when he travels here, he doesn't charge us travel time. So he's a really good deal, and besides, he's the best guy. So I'm hoping we'll hire this guy.
Comments? Questions? Do I have a motion to approve the contract?
I'll make the motion.
Second?
I have a motion by Cropus, supported by Lathrop, to approve the contract with Peter Cole to work as a labor negotiator on behalf of Grand Traverse County.
I'm sorry. Our undersheriff had asked to speak.
Certainly.
I couldn't
Nate
see
Elcher,
him.
Undersheriff, Grand Traverse Sheriff's Office. Thank you.
couldn't see you, I'm sorry. For the
Is that a short joke?
It is, it is. That was an unfair
It's a
jab.
protected
That was-
class.
No, Sarah's very tall.
Okay. I would like to say that we have worked with Smith Howey a lot over the last few years in many areas in labor relations, and specifically Janice Adams. And for us, she does a great job. She's never sat at the negotiation table for labor, and I understand the concerns surrounding wanting an outside attorney for that end of things. But departmental issues, significant employment relations issues such as terminations, are we going to discipline versus terminate? Janice has advised us for years in this. We've had EEOC complaints, EEOC mediations, unemployment hearings, you name it, we've been through it, and she has advised us correctly, and we have not had a lawsuit. So, and we currently have something right now, a very sensitive matter with a deputy and his fitness for duty, and she is in the process of advising us in that matter. So I have a little bit of concern about going into a new attorney situation for those issues, specifically A and C, 2A and C in the contract, because we have a very good relationship with Smith Howey right now in that capacity. They don't do our labor negotiations, so I understand the desire to go there, but I guess at a minimum I would request that we be allowed to conclude our current personnel matter with Ms. Adams of Smith Howey. And if not, and more so, if this board would even entertain us specific to 2A and C continuing to use Smith Howey. And I'd answer questions. If you have any questions about our experience with our labor attorney, I would be happy to answer those.
Comments? Questions?
Thank you.
Thanks, Nate.
So this contract locks in Mr. Cole for every labor item?
It does, that's what it says.
I'm assuming it.
We can go where we want, but this is for the labor negotiations of the various unions, and if I feel that I may want to utilize him for a specific case because of certain situations that he's had experience in, I feel comfortable in doing that. But I want to make those calls.
Okay. Other comments, questions?
Are we able to accommodate the sheriff's department to finish up their current cases with
Of
the...
course. They're separate issues as far as
So
I'm
this
concerned.
isn't something that's...
This is a separate issue. I'm not going to mix the two.
Gotcha.
And this has been asked for immediate approval, and I'm assuming the motion makers are fine with that.
Yeah, I am.
Bob?
Well, we mentioned Peter Cole's name, but the contract actually says Cole, Stoker, and was that Toski?
It's the name of the company.
So I don't know if we need to make sure that's in there.
Okay. Roll call vote, please, sir.
Lathrop,
Yes.
Johnson,
Yes.
Crawford,
Yes.
Kropa,
Yes.
Wheelock.
Yes, ma'am. And I apologize because we have one other item of unfinished business that did not get added to the agenda, and I forgot about it at the beginning of the meeting. Last week in closed session, we had a discussion with our attorney about the need to formally authorize him to proceed with a writ to the United States Supreme Court in regard to litigation of Carlson versus Grand Traverse County. And I would entertain a motion to authorize Chris Cook on our behalf to enter into a writ with the U.S. Supreme Court in regard to Carlson versus Grand Traverse County.
So moved?
Support. Motion by Crawford, supported by Johnson. Further discussion? If I could have a roll call vote, please, Sarah.
Johnson,
Yes.
Crawford,
Yes.
Kropa,
Yes.
Lathrop,
Yes.
Wheelock.
Yes, ma'am. And again, I apologize for not making sure that was on the agenda. It was one of those things that we came out of closed session last week. We told the people prior to going into closed session we would not need a decision, and then during the closed session, it was determined that we would need formal action to proceed. Okay, this brings us to new business, recommendation for appointment to the Beta Board. Did that subcommittee meet this
Have
afternoon?
that
Yes, we
here.
did.
Okay, we did meet today. I have the official paper here for Chris Kramer. We had a vote of 2-1 to reappoint Linda Wagner to the Beta Board for a 3-year term. I was the opposing vote. Commissioner Crawford and Lathrop voted yes. So that is the recommendation to the Public Health and Safety Committee by the ad hoc committee that met today. So
Needs to be immediate, too.
I would make a motion to recommend the reappointment of Linda Wagner to serve on the Bay Area Transportation Authority Board for a 3-year term effective immediately through October 31st, 2018.
Support.
I have a motion by Crocus, supported by Crawford. Further discussion? Those in favor say aye.
I would
I'm
just
sorry,
state,
Tom.
Mr. Chairman, that Linda Wagner has been chairperson of the board for, I think, at least 3 years. She came from California in transit, so she had worked in finance and transit, so she had a nice resume from that perspective. And I think when you have a change in leadership in an organization, if you can keep some stability on the board, that's going to help the new executive director a great deal, having a board that's in place and consistent. So I think it's a good choice.
Okay. I don't know that there's a reason this has to be for immediate approval. This position's been open for a little bit.
It was stated on the original paperwork from Chris Kramer that it is immediately through October 31st, 2018, which means that her term expired October 31st of 2015. So that's why this is for immediate approval. We delayed it a week from last week's meeting.
All right, because it's not on my agenda for immediate approval, so.
Yeah, it's weird. It just is
Okay.
on here. I think because it was intended to be on last week, maybe, and there was a delay.
So does the motion and the second wish to have this for immediate approval?
I do.
Well, you were the motion.
I was
Oh,
the
that's
motion.
right. That was me.
Yeah.
Roll call, please, Sarah.
Crawford,
Yes.
Cropa,
Yes.
Lathrop,
Yes.
Johnson,
Yes.
Wheelock.
Yes. Okay, this brings us to the second opportunity for public comment. Is there anyone wishing to make public comment at this time? George is just...
Come on, George.
All right, we'll move forward. Commissioner committee reports.
I don't have anything.
I have a few. I'm going to try to remember without looking. Friday, Dean and myself and Commissioner Max Bauer met with Frank Deturi from the IT and Amy Beyer and Kim Balke from CRA. And I'm happy to announce we have the first set of numbers today, which is kind of exciting. And we sort of hashed out some things we needed to hash out and regarding the letter of intent and the numbers that we would like to have. The bottom line that came out of it is if we do accept this funding, we're basically turning the project over to the U.S. government. So they make all the calls, they're the fiduciary, they do everything. And so the negotiations on the strings come with the U.S. government, not with a local entity. Therefore, a letter of intent would be signed in order to enter into agreements for the project partnership agreement with the U.S. Army Corps of Engineers. And that is about a 6-month process. So I reluctantly agreed to put the letter of intent on Dan's meeting, Ways and Means, and we will discuss it then. In the meantime, we will continue to hopefully get some numbers, because I don't think it's unreasonable to ask for numbers when you're pledging $2 million of taxpayer funds. So we did that Friday, and that was fun. Monday, I worked with Bob on the resolutions here. I met with Tom Bensley and Nate Alger in regards to the Central Records Agreement with the city and the county. And the County Board of Commissioners last year directed the previous administrator to move forward with it, and for some reason, he did not. So I asked the sheriff and undersheriff if our board needs to direct our administrator to move forward with central records, and we didn't think we needed a formal resolution, but it is a casual plea to you to get in contact with Tom Bensley. We have good numbers. Chris Forsyth already had drafted an agreement last year. We're ready to move forward. Nate Elger has sent a letter to Marty Colburn essentially saying your extension is up. It's time to negotiate this now, and he is giving them a deadline of the negotiations done and contract done by January 1st. The bottom line is, if it goes the way that we have drafted it, we will have an extra $120,000 a year going into the county for additional revenue on that agreement. Then we discussed a little bit about the Woodmere LEC contract, which is also expired. And that has so many moving parts that it's sort of a legal nightmare. So that one won't be as cut and dry, but we need to move forward with that because we're operating now without an agreement in place at the Woodmere LEC. So that was really nice of them to spend so much time there. I met with TART's Executive Director, Julie Clark, regarding the continuing discussion on snow removal on the TART Trail. Right now, Garfield Township, the City of Traverse City, Acme Township, all participate in paying for trail snow removal. East Bay Township, as of when we met Monday, had backed out. TART will be covering their portion if they don't have a last-minute plea deal in a meeting. So ultimately what this means is we're going to have to discuss this. The original TART Trail was built with an easement from the County Road Commission, and it puts Grand Traverse County as the holder for this Grand Traverse County Road Commission. And in the original contract from the 90s, it also shows us responsible for trail maintenance, and that refers to snow removal. So therefore, this is going to all come back to Grand Traverse County at some point, and I just wanted you to know we've been talking about this for about 2 years, and we're moving forward a little bit more quickly now on coming up with a solution, especially with the Boardman Lake Trail completion, hopefully coming in the Boardman River Trail. And I lastly wanted to update you on the Easling Pool, since it is closed and has been closed since our last meeting. We did have our Parks Board budget meeting last night. Of course, the pool is a significant part of our budget. I've been working with Christine Erickson on a lot of numbers. We have written 5 business plans for the pool with every possible scenario that we can come up with. I've weighed the consequences of all of them, and I have a favorite. And the favorite is entering into an agreement with the YMCA. They have come up with an agreement that will initially have us have a $50,000 management fee with a sliding scale down to 0. That sliding scale is based on the number of people that become members of the Easling Pool. They're calling it the East Side YMCA is what they're calling it. And if we reach that threshold earlier, our management fee is gone. If we reach it about when they expect, they're saying 2 to 3 years. So it's really a fairly decent proposal. So the Parks Board is going to consider that, but that is what we wrote into our budget last night. And with that being written in, the budget that our director will come forward to this board with is $300,000 less than last year's budget request from the county board. We have done a significant amount of work. That is a decrease in payroll, benefits, maintenance, you name it. We've worked hard on it. Jay Buckmaster from the Y and his finance director will be here with Chris Erickson for Ways and Means to present this particular business plan that we thought worked the best. However, all the business plans will be presented to the county board. The one I worked on the most was the plan of closing the pool indefinitely. It's a lot more than just turning off the lights and locking the door. When I crunched all the numbers, in the initial year, we would save $96,000. Beyond that, it would cost us roughly $60,000 to $100,000 a year to keep it vacant. That is significantly more than the YMCA contract. So therefore, that's where we were going. So we worked all day on that and quite late last night, and I just wanted to let you know that's all moving forward, and the pool is not sitting there being forgotten.
And Mr. Chairman, I had gotten a call from the Record Eagle tonight and asked me about the discussion with the city for them taking over the facility. I said there hadn't been any discussions, but I think there had been some contact between our chairperson and the newly elected mayor and a previous member of this group, Ross Richardson, about the city taking over the facility. I didn't know what they meant.
The entire
pool or
Civic
whatever.
Center.
The what?
The entire Civic Center.
Yeah, for $1. And I said I didn't think there had been certainly hadn't been any staff discussions I was aware of, but it was at the elected officials level. And I simply stated that we're looking for solutions, and that if that was a viable one, we'd certainly be willing to talk to the city and see what they had in mind. I did find an agreement from 1976, interestingly enough, and I think you may be aware of that, which stated that it was a collaborative effort between the college, TCAPS, the city, and the county, and he asked me how it got to be. It was the total county's responsibility. I said it just evolved over time, but it was intended to be a collaborative partnership up front. So I said from that perspective, if the city wanted to get back into it, that certainly was a reason to do it, because originally it was a collaborative effort with there. So just so you're aware of that discussion and what took place. So probably be an article in the paper tomorrow based on that topic, and I don't know if the paper was represented at your meeting last night or not. But
No, somebody did call the paper. It was a very small group of us. We met at Twin Lakes. It was not filmed. Somebody that was in the room with us must have called the paper last night, because I heard from them as well. There was perhaps a 3-minute discussion of this when we went through the amount of business plans and all of our particular options. Commissioner Max Bauer, who sits on the Parks Board, did say there is another option. I just want you to know about, because it had been talked about publicly. Our Parks Board nodded their head, and that was about it. And somehow we got a call from the Record Eagle today. So,
well, is that something that when I get on board, that you'd like me to explore with the city, or is it not necessary to do that, or should we wait for the new mayor to reach out if he wants to do that or not, or what would your preference be?
well, it certainly wasn't anything that came from the Parks Board level. I believe this was a campaign issue of the new mayor. I think it was a reactivity to the closing of the pool. It's like, hey, we can take it. But a lot of the posts that I saw that the new mayor made had a lot of responses saying, we think the county's got that covered, the YMCA's coming in, they're working on that. I would ask that at least the County Parks Board be allowed to present their work. We've been working a couple months on this now with the Y. The Y is willing to invest a significant amount of dollars into changing our meeting room to a gym, and therefore giving a little bit more incentive to be a member of this pool, because you get a little bit more than just that. Those purchases need to be made soon. So they're going to want to sit down and have a discussion with us as soon as possible. Ways and Means was where we had chose.
I did get a call from Jay of the YMCA on my way over here, and I did meet with him and Chris Maxbauer last Sunday afternoon on that very topic, and they did mention the $50,000 fee, which you had indicated, and also utilities, and I guess average maintenance was maybe $70,000 to $90,000 more, on top of the 50 in terms of a yearly cost. But that's
And I
all.
have broken that all down in the business plans.
Good.
And just so that I can be on record about it, my thought of no, not the pool, the city taking over. The Legion has a long history there of those ball fields. They built the fields, and I'm not comfortable with the city taking over the Civic Center, because I would worry actually in the future what that would mean for the ball fields, in all honesty. So I will also, while I'm talking then, I did attend the ad hoc committee meeting of the Parks and Rec to go over Legion baseball fees for next year, and I do have to say that the Parks and Rec committee is doing wonderful work. I mean, not just because of our relationship as far as the Legion, but it has made it a lot nicer with the board and with Christine Erickson for the Legion, where we're not fighting over how much are we going to pay. I mean, the previous director there was up there.
Stop now, Bob.
He didn't like us at all. Let me just put it that way. And we fought tooth and nail for every little thing, and, you know, I think his effect was basically to try to get us off of those fields, so it is night and day, head and shoulders above what's happened in the past, and it was very pleasant to do business this year with the Civic Center as far as American Legion's concerned, so.
Dan?
I don't know if you know, I was surprised to find this out, that from Long Lake area, we have a Congressional Medal of Honor winner named Demis T. Craw, C-R-A-W, Colonel Demis T. Craw. And I'm working with, I've decided to work with Dr. Dan Benechik and Colonel Terry Hahn to see if we can honor this man who gave his life in World War II very courageously. And in doing that, he saved countless, hundreds and thousands of lives, and I'm glad to tell you the story about it later. But we're hoping to get, when the new VA clinic is built, to name this clinic after him. So I'm working on building some support for that, and I hope you guys will join me in honoring this very special person. He's the only one in Grand Traverse area that's ever won this award. And the story of how he won it is incredibly moving. So I want to announce to you that I'm going to be spearheading this, and I hope we can honor him in this way.
Just a couple little things. You know, we're fortunate to have a Parks and Recreation Commission that, you know, is dedicated to providing recreational facilities in our community. We're very fortunate to have the partnerships that we have with ICE, the American Legion, and the YMCA. They've served us well for a long time. We all know Grand Traverse County has been a landlord of facilities, but the operation of those facilities is dependent on these nonprofit organizations. You talk about the evolution of the agreement between the college, the school, and the city and the county. I'm not sure it's an evolution. I think it's more of a dissolving of the thing. It's kind of whittled its way down to where Grand Traverse County is the seed that was in the bottom that's holding it all together and still working on it. You know, in regard to the central dispatch discussion or central records discussion earlier, we have to remember that not only was Grand Traverse County without an administrator for much of this time, so was the city. And so, you know, I think and they were without a police chief. So we've had there's a lot of issues of why that contract wasn't settled prior to now. And, you know, I think we've all
Well, the board directed the administrator in November of 2014. He didn't leave till May. There is a lot of disappointment on the side of the sheriff's department in this, and rightfully so. And it's time to fix it.
The only other thing that I would mention, and I don't know whether it's committee reports or under notices and announcements, just a reminder that the Michigan Township Association and the Planning Department will be sponsoring the annual Planning Recognition Dinner tomorrow night. This is a facility or an opportunity to recognize not only individuals but developers who have done a great job in developing properties and projects within our community that have benefited the group the community as a whole. So that's being held at Boone's tomorrow night at 6 o'clock. If you pre-registered, I'll probably see you there. If not, you know, I just wanted to mention, you know, this is an opportunity to recognize not only individuals but developers that are doing a great job to serve our community. Any other comments? Okay.
I'll make the motion.
All right, we need a motion to go into closed session in regard to Whitney versus Grand Traverse County.
I made the
We have a
motion.
motion by Crawford, motion by Kropas, second by Crawford. I'll get it right, yeah. Okay, we need a roll call vote to go into closed session. We do not expect a decision coming out of this.
I don't think so.
I believe we're not. And we are going to go to the training room tonight instead of the small room because we have a number of people that have been invited to participate in this discussion.
Crawford.
Yes.
Be a party.
Cropa.
Here. Oh, yes.
Lathrop.
Yeah.
Johnson.
Yes.
Wheelock.
Yes, ma'am.
Thank you.
Okay, we will be going into closed session. We will come back into open session and adjourn. We won't be making the decision this evening.
Am I correct that next?
2020.